Welcome to the Heart Podcast, Skills for Mental Wellness. Thanks for coming, everybody. We're glad to have you here. I have two amazing women who are therapists and fantastic in their own right on skills-based mental wellness, and I'd like to introduce them to you today. Sumitra, can you go ahead and introduce yourself and a little bit about your background? Let our listeners know who you are.
Hi, everyone. I'm Sumitra. I am a licensed clinical social worker. I am also the owner and founder of Jacob's Ladder Therapies. We are a therapy group practice, and we specialize in treating teens, tweens, young adults, parents, families who have mood and personality disorders, communication problems, having issues with school stress, and we use individual therapy, group therapy, family therapy as our modes of treatment. And we are trained in dialectical behavioral therapy, or DBT, which is a skills-based format for mental wellness. Thank you, Barbara,
Fantastic.
for having me here.
Absolutely. I should say, I forgot to say this earlier, who is with us? Sumitra Johnson, who is a licensed clinical social worker, and Maritza Noriega. And Maritza, I don't know your full title.
I am. Thank you for having me as well. I am a licensed marriage and family therapist.
Great. Go ahead and introduce yourself as well.
So my name is Maritza Noriega. I'm a licensed marriage and family therapist. I am currently the lead clinician at Jacob's Ladder Therapies, and I specialize in working with teens and young adults who are struggling with depression and anxiety. My form of therapy is also DBT trained, so I do use a lot of skill-based in my individual sessions and in group therapy, and then I also use a little bit of cognitive behavioral therapy as well. I am Latina, so I am bilingual and provide therapy in Spanish as well. So I like to work with diverse populations and cultures and supporting whatever mental health challenges clients bring.
That's so awesome. We really, really need that diversity in our therapy. Yeah. Thank you. All right. So a question for you guys is skills-based mental wellness. What does that mean for you in general? Like what do those words actually connotate to you in your head? What does it bring up?
I think for me, when I think of skill-based mental wellness, I think of all of the things that people feel they should already know how to do. Kind of those everyday, like this should be something you're taught as a kid, like everybody just sort of knows it and absorbs it in their life. And the reality is, if you haven't been taught these skills, you really don't know them. So all of those should statements about what I should know or what you should be able to do kind of gets thrown out the window if you really don't know them. And I find that a lot of the teens and young adults that we work with, they don't know the skills. Their generation is different. And if they haven't been taught the skills, they don't know them. And it causes them to have quite a bit of emotional distress.
Right.
I think when I think about skill-based mental wellness or mental health, I think in addition to what Sumitra saying, I think also giving our clients the foundation of what they can do when times get tough, because the reality is that life is difficult. We are all going to go through challenges, and it's more about what can we do in the moment to help us overcome those difficulties. So giving clients a set of skills that they can use not only in the moment when they are in therapy, but that they can continue to apply to everyday life, at school, with family, in our jobs. So it's actually giving them foundational skills that they can continue to implement in their day-to-day lives, whether they are in therapy or not, for a long period of time.
Nice. I love that concept. We are totally on board with that concept here at the Heart Program. We talk about how the skills help you get out of a hole, as we talk about mental health issues, and also help us climb a mountain so that we're thriving in the things that we want to do, not just the stuff that we need to do, right? So life is full of challenges, full of struggles. I mean, I feel like that's the whole point of life. And somewhere along the line in our society, we came to this idea that life should be easy. And if we're struggling, there's something wrong with us. What do you guys think about that concept?
I think that's definitely something that pops up a lot in therapy, right? The stigma of what am
Yeah.
I doing wrong? What is wrong with me? Why can I not
Right.
do quote unquote the normal? Right. And I think that's what makes it then challenging or challenges people in accessing services, but in also being able to kind of navigate these challenges, because it's very easy to fall into this hole or to struggle with recognizing that it's okay for me to not know it all or for me to go through these challenges, right? But I think a lot
Yes.
of the time we put on the peach colored or rose colored glasses and think that it's just going to be nice and easy, and the reality is that it's
All
not.
the time. Yeah. Yeah.
Mhm.
Absolutely. Demetra, your thoughts of that?
I also think like from in a lot of cultures, you are supposed to you're supposed to just be able to do it all. You have to be the strong woman, the strong man, and mental illness is, something that's wrong with you, and you need to like put it to the side and
Yeah.
just, keep going. And
Just do it. Huh?
yeah, you still have to make those good grades. You still have to get that good job. You have to make this amount of money. And without knowing the skills on how to do that, you're just sort of lost,
Yeah.
and following some roadmap that is taking you to this, into this abyss, and you don't know where you're going. So it causes so much confusion, and you start having an identity crisis. So it's about just not really knowing where you're going in life.
So that's an awesome segue about the skills and what are they? We've been talking now about skills for a few minutes, and the things that we know that people feel like they should know, but they haven't necessarily learned, all that, that we're not teaching these skills explicitly anywhere in their lives, whether it's in school or at work. So what are the skills? What are some examples of skills that we need to be mentally well?
I think one of the skills, when we talk about when you have anxiety, and we use a lot of the tip skill. And the first part of the tip skill is temperature. And it's about, putting coldness on your face, trying to get that dive reflex, to bring your heart rate down. Well, I think historically, if you're having anxiety, people say, go to the bathroom and splash water on your face. Well, there is actually a method to doing that. So it's not just going to splash water on your face. It's not warm water, it's ice cold water. And so if you don't know that, and it's just something that's been passed down, well, I'll just go splash water on my face and I should be fine. Well, no, let me explain to you exactly how you do this. It's ice cold water. And we do this because we're trying to bring your heart rate down. Like there's a complete method to doing that. And if you don't know that, you're not doing it correctly. So it's not working. And it just becomes kind of this, this old wives' tale, I guess.
Exactly.
So, you really have to learn how to do it.
So there's actually methods and rationale, like an operating function behind, like a reflex, as you were saying, the dive reflex, behind the skills. So it's extremely scientifically based, neuroscience based, physiology based. So it's not just, oh, we're telling you to do this thing and because it'll make you feel better. A lot of times when you see tips and tricks on the internet for feeling better, they are exactly that. They're like, oh, here's a tip, do this, do that, eat this, go here, use this object, and it'll make you feel better. And people try it and it doesn't work. And a lot of that is because, as you described, they're not doing it the right way, right? And when they do it the right way, lo and behold, it works so fantastically because we're all human species and our bodies really function very much the same in many capacities. And that's the thing that the skills very often are drawing on, is that base humanality. Yeah. Mirza, what's another skill that you...
Yeah, I definitely agree with Demetra, and I think the tip skill is probably, as DBT trained therapists, that's one of our go-tos. It's something that we swear by, that we sometimes end up using as well because it's so effective. But in addition to that skill, I think the identify and label emotion skills. It's literally, I think, the foundation of most of my work initially in therapy. In order for anybody to be able to know what to do in order to handle an emotion, you first have to know what you feel. Right. And it seems so simple and we say it so easily, like, yeah, you might be feeling sad or worried or anxious, but it actually takes a lot of skill and practice to recognize what you feel, what is actually coming up for you. How do you tap into that to then know exactly what you can do to help you with that emotion? Because if you don't know what you feel, then we're not going to know how to help, right? Or you're not going to know what to do. So I think identifying and labeling emotions is super important in order to build that foundation as to what do we do from here on. Once you've been able to recognize what you're feeling, then we can kind of help and regulate that emotion.
Mhm.
Excellent. So
Yeah.
what you're describing is this kind of self-assessment or self-awareness component of the skills, right?
Yes.
Mitra, what were you going to say?
I think adding to that, so a lot of times clients come in and they do talk therapy and they sit down and they talk and they pour their heart out and they're like,
Right.
okay, like, how was that useful? And it's like, so there was pieces in that where you identified and labeled emotions. And let me tell you which ones you identified and labeled. And so without that skills piece and showing them how they use the skill, they don't necessarily have that confidence to even want to come back and engage in therapy again. But when you show them, look at all the skills you just used in this session, they're like, oh, I actually did something. And so it gives them a goal to work towards as well. So it is about using the skill, identifying the skill that you're using, and continuing to use it over and over again. So you know what you're doing. You're not just sitting down talking, you're actually doing something.
Yeah. In management speak, they talk about you can't manage what you can't measure.
Right.
So self-awareness and self-assessment is that component of measuring where are you right now so that you know what to do to fix it, to make it different. Because if you don't even know where you're at because you're shutting it out or you just don't know how to read your own emotions yet because you haven't learned the skills for it yet, you've not learned the words, the vocabulary, the things that come along with it, then it's really hard to figure out what to do when you don't even know where you're at.
Right.
Yeah. Do you think that where in our lives do we teach those, or do we learn or pick up those kinds of skills currently without being taught explicitly either in therapy or in a curriculum like the HEART program?
I think we have the opportunity to pick up some of these skills in different areas, right? And I think Tamitra had mentioned culture earlier on, and I think that has a lot to do with it, right? I think, and I can speak for myself in the Latino culture, a lot of these things we don't tap into because coming from a mentality of you got to work, you got to hustle, let's prioritize, you being productive, being effective. We aren't given the foundation to identify and label emotions or to tap into those feelings. And yet we do get another set of skills, right? Which is that communication piece of interpersonal effectiveness skills, right? Like how do I build and foster positive and healthy relationships because we view our family as our support system, our community as our support system. So I think we may not get all the skills, but I think we're able to pick up some of these skills along the way in different experiences and different life situations that we come across.
Yeah. So that kind of tacit learning of stuff like being thrown in the water and learning to dog paddle.
Yeah. I think schools nowadays are starting to implement kind of a wellness program for the teens. I'm not sure in terms of this generation how much of the skills, they're getting on a regular basis, at least not knowing if they're getting the skills. We get a lot of teens that come in and will say, okay, let's talk about self-soothe. I already know how to self-soothe. I pet my dog. Okay, great. And that's one sense that you're using. Let me tell you about the other 5 senses and the other ways you can self-soothe. So what happens if your dog doesn't want to pet you? So it's really diving in deeper and like challenging them into, something. Yes, let's build on that. Let me show you the rest of it. And so I think little pieces are, it feels like common knowledge. So there's little pieces that teens in particular are getting, but not necessarily the whole piece. And that's what a therapist or a wellness coach can provide.
Right. Yeah. I think those are excellent points that you both raised that, we as adults and the kids around us are picking up bits and pieces here and there, but because it's not been explicitly told to them that it's a skill until we do that, in our own therapies, they don't know that that's something to do in other places even, right? To translate that thing that they do here in this place to this situation and that situation. Or, the reason why this works is because here's the underlying reason. And guess what? You can do it in these 5 different ways, depending on, if your cat is not here in the room and you're at school and you have other people watching you and, what else can you do in a public setting? So I really like the idea that skills, the training is explicit and it helps us think more intentionally about I need to find a way to do this skill. Here I am. What do I have available to me.
Yeah.
And I think you bring up a good point with that intention piece, right? Because I think, like Demetra said, we have a lot of maybe teens or just older clients who will say, well, I already do that, or that makes sense, that's common. But the intention is what really matters, right? It's like, what are you using that skill for? Are you recognizing that you're using it to address this challenge or this emotion?
Yeah. Applying it more consistently and more regularly in a variety of places, as opposed to just one or two.
Yes.
Yeah.
Great. So what does it look like in your, well, you guys gave some hints already as to how you work with skills in your practice, like you said, somebody pours out, their emotions or what happened in a session, and then you go back and you pick through it and sift out where they used various skills so that they get a sense of, oh, I'm already doing it, now I can maybe do it more intentionally when I go back in the wild again. What other things do you guys do in your practice around skills and skills training and skills education that you could talk about here?
So I think one of the things that we do is we try to incorporate activities. So we try to do activity-based skill building. So we may play a game. Barbara, we've invited you to come and do projects with our teams and group. So they really get not just, we do the written piece, right? So they have the paper in front of them and they can see. So there's a visual. We talk about it. So there's an audio. And then we do activities. So there's some sort of movement. And then we try to reinforce it with something that they can take home to like really kind of remind them. And then we continuously reinforce it. So when they come back, did you use the skill? How did you use the skill? Did it work? Okay, how can we revise it? What other skills may be helpful? Like it's a continuous, constant thing, skills, till they like don't want to hear the word skills anymore. They're like, it's like, no, skills. And then it just becomes a language. So like teaching skills is like teaching a whole nother language. And so we try to drive that continuously.
And I think in addition to that, one of the things that I also like to do is to set goals, right? Treatment goals. What are we working on? What is the reason why we're here? What are the challenges that you're having? And setting goals that are going to help us address that specific challenge. And the way that we're going to achieve those goals is through skills. So you're going to take something away that's going to help you address that challenge. And we're also able to measure, right? We're able to measure if there have been changes, not only by what the client is reporting, by what we're noticing, but are we meeting our goals? And if we're not meeting our goals, then what do we need to do differently? Maybe we need to increase the skill use. Maybe we need to be more intentional about skill use. So I think that also gives us opportunity to have a vision for what we want out of the sessions, but it also helps the client feel like I am working towards something. I am getting something out of this.
Right. Those are super important concepts in therapy that I think are maybe kind of, I don't know, I want to say they're kind of new. I just feel like they haven't been as much, DBT has been around for like 30, 40 years now. And I feel like very few therapists actually use DBT or have this idea of having goals and, measuring the outcome. But it's so important because I think people have gone to therapists for years and not really been super clear about what is it that they're getting out of the therapy. And it's almost like, being a physical therapist, I'm going to equate this to some kind of physical issue because it's easy to see. It's like having a crutch and using that crutch all the time, or having a brace and using the brace all the time, the standard therapy, where you don't know what is it you're trying to do with that brace or that crutch, and it's supporting you, but you aren't gaining the skills on your own, the strength on your own, the flexibility on your own to do the things that you want to do. So I love the fact that you guys are focused on goals and outcomes. And so that's actually one of my questions is, how does your kind of therapy differ from more traditional therapy in terms of outcomes, and what can people expect to achieve, and how long, do you have time boundaries on your therapy? How does it all work?
So the thing with skill-based therapy is that it's time limited. So we fully believe that therapy should not be forever. Therapy should not be a chit chat session with your best friend. It really needs to be, like Maritza said, setting goals, achieving those goals and moving on from therapy. And then coming back if you need to access, services again. But with skill-based training, you can do that. So we do look at, do 3 months, every 3 months, we're starting to look at, are we getting closer to our goal? Are we getting closer? We hit that 6-month mark and we haven't made any progress. We need to look as the therapist, as the client, and we need to sit down and figure out what's going on, because that's a really long time to learn all these skills and nothing has changed. So it helps us, one, to be able to help multiple people. So we're not bogged down with clients that we're seeing for years and years and years. It's like for me, in terms of my philosophy, being in therapy for years and years and years probably means that you're not making progress, or the roles have gotten kind of enmeshed, where, it's like you enjoy being with them as a therapist, they enjoy being with you. So this is just kind of the highlight of your day. Nobody's really making progress. We're just kind of, it's just a nice part of your day, where it's supposed to be, to me, it's supposed to be learning something. And like, you don't stay in school forever. You go to school, you get the skills, and you get out and get a job. So like being
and then you
a perpetual student, probably means that you're stuck and you don't want to move on to the next level. And so having skill-based, like everybody comes in with a problem. There's always going to be a new problem, but having the skills means that you can address whatever problem comes up. It's, you can shift no matter what. So it's not like with your therapist, you have to talk about every single problem. You just have to talk about the skills you need to address whatever comes your way.
Yeah.
And I think one of the things that I am very mindful of is I tend to do what we would call like that traditional talk therapy, right? And I also incorporate skills-based. So I try to maneuver it in there in the sense of my client comes in, they have these challenges, providing that safe place, processing, and also giving them the tools to then handle or address that challenge. So I do a little bit of both in my session, where yes, we can process, yes, we can talk about feelings, we can talk about that challenge, and then also giving them the skills to continue to work through that challenge and to empower them. Because that's what therapy is also about, right? Empowering our clients. We are giving you tools that maybe you didn't have before. We are letting you kind of learn new ways to address these difficulties. And then we are giving it to you to go out into the real world, quote unquote, and do these changes. So I think I am able to navigate both, but like Demetra said, always bringing it back to the skills and working towards our treatment goals.
Mm-hmm.
Yeah, I love that concept of empowerment. That's so critical. I mean, skills are all about empowerment, or empowerment is all about skills. I don't know which way to put it, because they're so intertwined, right? To be empowered is to have the confidence to feel like you can do what you need to do. And really that's all about, do I have the skills to do what I need to do? Right?
Yes.
What are some examples of like a goal that somebody could imagine working towards in a 3 or 6 month period? What are, give people an example of what you might be working towards.
I was going to say one of my typical or like common goals that clients will say is like, I want to learn how to handle my anxiety better. Great. So within the next 3 months, we are going to identify 5 skills that you will be able to practice and implement in order to decrease anxiety. So it's not that we're saying that anxiety is going to go away, right? We're going to be realistic. Right. We're going to decrease, and we're also going to give you a set number of skills that you're going to be able to implement and practice.
Mm-hmm.
Right. So it's about managing stuff. Right.
Yeah. I think for me, I do work with a lot of clients who have borderline features, borderline personality disorder, or borderline features if they're younger. And the biggest complaint I hear is, I don't understand why I don't have any friends, and why people always leave me. And so we identify, like, what is it? Why do you think it's this way? And relook at, how do you relate to people? And then bringing it back to the skill, there's a set of interpersonal effectiveness skills that we can teach that you can use, and see how this works, see how that skill works, and trying to pinpoint exactly why they're not able to maintain relationships. What are they doing that's sabotaging these relationships? What's getting in the way? So once we can identify that, we can throw these skills at them and, like, okay, try this, try that. I mean, there's like 8 interpersonal effectiveness skills. And we're going to try these and we're going to practice these on your family. Who is a safe person? Try these on mom, try these on dad, try these on your sibling, and see how it works for you. And then try them outside the home. So, it's about skills and it's not necessarily I need to know exactly what they're doing. It's that I need to be able to help them identify which skills may improve their ability to maintain relationships.
Yes. I think that actually that is becoming increasingly common.
Mm-hmm.
I don't know, Maritza, if you deal with teens or people in general who are having trouble with relationships more and more, but I feel like there are things in our society that are pushing us to pick up the characteristics and traits of borderline personality disorder. And I wonder if maybe one of you could just kind of define what borderline personality is and what are the characteristics, and then maybe we could dabble in that conversation a little.
Mm-hmm.
I will defer to Tamitra, who has way more experience with this than I do.
Okay. So what is BPD?
So BPD is a personality disorder that in which people have a very hard time with maintaining relationships. They feel like they can't be alone, and they will literally do almost anything to hold on to a relationship. They're typically referred to as toxic, and they often will even resort to life-threatening behaviors such as suicidal behaviors and or ideation, thoughts, self-harm, and it becomes this perpetual cycle of if I don't have the relationships that I want in the way that I want them, then I just want to kill myself. And they tend to be in treatment for a long time when they don't, especially if they don't have the skills to manage relationships. And, typically you can't be diagnosed with borderline personality disorder until you're age 18 or over. However, like you said, Barbara, it is becoming increasingly common to see teens and even tweens with these borderline traits. And I do think a lot of it's related to social media. And, your popularity is not just the people you know at school anymore. It's about what your social capital is online. And that's very hard to get and maintain. The level in which these kids have to be on all the time, there's no downtime, makes it a very pressured to maintain this perfect person. And so if they're not up to the standards of other people, it becomes, it's really hard. So a lot of them then end up turning to these characteristics to just, I have to maintain this relationship. You can't leave me. And, they don't know how to maintain relationships anymore.
Like examples of this real strong need for approval externally, like other people, social acceptance and that kind of thing. I mean, I think teens go through that anyway, because they're at that time in their life when they're moving away from their family and they're looking to find their tribe. And so they're looking for approval from other people, but the social media component just exacerbates it. And, the whole concept of likes and, dislikes, that exacerbates it. And then also as far as borderline personality traits go or characteristics go, I think the impulsivity and the black and white thinking are two of those components that are also exacerbated by social media, because we don't have time on social media to have nuanced conversations. We're just supposed to respond with emotion. That's a totally impulsive, emotionally driven behavior that is very borderline. And it's actually what we're trying to teach people not to do. And yet social media drives us to do that very thing. So our generations are being taught or trained to behave in this way that is associated with a borderline, with a personality disorder. It's kind of crazy.
Yeah. And that impulsivity in a brain that's not fully developed, that's really hard to contain. Control. And skills, like really concrete skills, and you have to drive that into them so that that's the forefront in their mind.
Yeah, so that they're thinking about that all the time, huh?
Mm-hmm.
And I also want to add that I think the pandemic affected a lot of our teens and tweens, and it definitely took a toll on relationships. And I think it also led to a lot of that impulsivity, right? Clients are feeling, or just people in general, feeling really lonely, really isolated. Our world completely stopped.
Yeah.
And I think that also has played into, us seeing more clients who present with BPD traits.
Mm-hmm.
Yeah, I for sure. What, based on your exposure and your experience during and after the pandemic, what have you noticed of what's going on in the population because of the pandemic? What kind of concerns or behaviors or thoughts and fears are people experiencing?
I think I noticed a big increase in anxiety, social anxiety, depression.
Do you think that's like a lack of practice kind of thing? Like teens are going through that period, because I know I saw this. I'm sorry to interrupt you, but I know I saw this with my daughter. Her last year of middle school was during the pandemic, and then she moved to high school, and the whole switch from middle school to high school, not knowing people and being in that uncertain stage of your own development, who you are, she got really shy. Like, she's shy to begin with, but it was even more exaggerated because she hadn't been practicing and like exercising her muscle for dealing with shyness, as it were.
Yeah.
Yeah, I think it definitely has to do with that, right? We take them out of the natural kind of just day-to-day life, and we completely shift it to, there is going to be no interaction, or your interactions are very limited, right? It's going to be only family or like these 2 friends that you can see,
Right.
compared to being at school or my sports or my activities, right? And I think also what added to that was the online schooling, right? Where a lot of schools were requiring for kids to have their cameras on, for your mic to be on. And now I'm self-conscious because I'm constantly staring at myself on this screen, and my peers are all looking at me. Whereas before it was maybe like that one class or those 2 classes where I didn't know a lot of people. And now it's like I'm face to face and having these interactions. And I think it made teens more aware.
Yeah, to be staring in a mirror all day long.
Yes.
Yeah. I also see that our high functioning teens who were doing so well in school, then they went online and they, completely just bombed, that school year, and they come back and they just don't have that self-confidence anymore. It's like, this is the first time that they've ever failed, and they failed for a whole year. And it's like, they don't have that confidence, and they don't have the skills. Like, it's like you said, Barbara, it's kind of this all or nothing. And it's like, I was good, now I'm not anymore. And so there's no like sense of redemption, or being able to understand that we were in the middle of a pandemic. You didn't actually fail. Let's rethink about what happened, and how can we move forward from here. There's just this sort of, and I see this with parents. It's like, well, they did terrible that year, so now we need to like kick into high gear, and like they need to make up for everything that they didn't do before. And it's like, that's a huge responsibility. And
pressure.
No matter how high functioning you were, that's unrealistic that they're just going to be able to make up for a whole lost year. And it wasn't even their fault. So I think like the confidence has decreased, and the ability to the drive to even want to be functional or as functional as they were before has decreased.
So motivation also.
Mm-hmm.
Yeah. So thank you very much for everything that you guys have been talking about today. We're coming kind of to the end of our time, but we have a few more minutes left. And what I really want is to get from each of you, like, what do you want listeners to take away from this conversation? If they could only remember one nugget, what would that nugget be for you?
Ooh, that's a loaded question.
Yeah, we talked a lot about so many interesting things and really important things, but if there was one thing that people walked away from this conversation with, what would you want them to know and like have in their heads and their hearts to help them going forward?
I think what I would want listeners to take away from this is that it's okay to not be okay. And that if we're not okay, there are things that we can do to help us address those challenges. And that's why skill based mental wellness is so important because it allows for us to build tools that we can continue to use throughout time.
Yeah.
Nice.
I would like the parents of the audience to take away from this that skill-based mental wellness is a family wellness plan, not just a teen mental wellness plan. Like we've said, learning skills is like learning a whole new language. If your whole family is not speaking the same language, there are going to be huge communication gaps. So just it's as important for you to learn skills as it is for your teen to learn the skills.
Absolutely. Yeah, that whole immersion concept, right? In order to do, well, so there's this concept that knowledge is a rumor until it lives in the muscle. Have you heard this quote?
Yeah.
And I think Brene Brown has made it super popular, but it comes from the Asaro tribe in Papua New Guinea. And it's this idea that, you know, until you actually do something, you don't really know it. Like you can study all you want about juggling or swimming, but until you actually get in the water or like throw the balls around, you don't know. You don't know what's going to go wrong. You don't know how it feels. You don't know how, you know, you get after doing it for an hour or anything like that. So the having to do it and practice it with skills is critical. And then this idea that everybody needs to be involved is also really important. And that's what we noticed when we were working with just the high school students, that they were like, well, you know, this is great information, but the adults around me aren't modeling this information. They're not doing what you say we should do. So what's up with that, right? And that's a lot of why we talk with other adults, you know, teachers in middle school, administrators, and parents to try and teach them how important it is that they also learn and use the skills so that the teens pick it up easier. Yeah, immersion.
Yes.
Well, is there anything else you guys would like to add right now?
I just want to say thank you for inviting us
Oh, of course.
to the podcast. I really do appreciate being able to share, you know, our experience with skills.
Yeah.
I'd like to echo that and say thank you for allowing for us to have this important conversation, because I think it's not very common for therapists to talk about skill-based therapy or mental wellness. And I think it's important for people to hear what it is, and that, you know, we're out here and we're trying to help, and that things can be different, and we're willing to kind of work as a team. Like Tametra said, it's not just the therapist, it's not just the client, it's kind of that support system that can also benefit from the skills.
Yeah. Absolutely. So can you guys remind the listeners where they can find you?
Yeah. So again, our group practice is called Jacobs Ladder Therapies. You can find us online at www.jacobsladdertherapies with an IES.com. And we have clinicians who are available to take new clients, both in person in our office in San Jose and also virtual anywhere in California.
Nice. Excellent. So we'll put that in the show notes so that people can have it and they don't have any typos. Thank you so much for your time, ladies.
Thank you.
Really appreciate it.